I'm Jamie Larice. I am the Wellness Promotion Developer and Educator here at St. Peter's, and I've worked at St. Peter's for about 4 years. Well, nationally, less than a quarter of people currently, stats from 2018, show that about 16% nationally still use tobacco products. That number is lowering for cigarettes, but increasing for other methods like electronic cigarettes. In Montana, we have higher national averages for all of the age groups. Most of the adults who smoke make up about 17%, and about 10% of Montana adults utilize e-cigarettes and smokeless tobacco. Well, tobacco use is most certainly continues to be on the rise, especially with new delivery methods. Efforts to combat cigarette use have worked and has decreased overall, but again, with other tobacco delivery systems like electronic cigarettes, those numbers continue to go up. All of them are dangerous. Reason being is that what's in tobacco is nicotine, and nicotine is the chemical compound that is addictive. Obviously, anything combustible, anything you light on fire and inhale will be dangerous, but what nicotine does is it gets you addicted, and it sends a pleasure response to the brain, which keeps you addicted. Smoking anything, especially with cigarettes having over 500 other chemicals in it, is also dangerous, and smokeless tobacco has over 300 chemicals in addition to the chemical compound nicotine. As far as e-cigarettes go, they're not regulated by the FDA, so we're not exactly sure what's in them, but with the recent advent of lung-associated deaths and disease, we know that vitamin E acetate that's in them and the way that they're being inhaled is creating a lot of problems for the lungs. Well, we know that tobacco causes cancer, and not just lung cancer, but various other types of cancer. When you have especially cigarettes and vaping, what you're doing is you're compromising the lungs' ability to bring in oxygen. The whole point of our lungs is to be able to bring in enough oxygen, deliver it to our cells so that our body's functions can become normal. After years and years of tobacco use, what you're doing is you're filling the lungs with nicotine, with smoke. It's not able to bring in enough oxygen. Without enough oxygen, your bodies and your vital organs don't get enough to be able to sustain. And so other than lung cancer, we can associate tobacco use with various numbers of cancer. One of them people don't realize is bladder cancer. The #1 cause of bladder cancer is cigarette use. As far as chewing tobacco, considering that's not going to your lungs, what you're doing is you're compromising all of the vascular entries in your mouth. So jaw cancer and esophageal cancer is really common in that. As far as e-cigarette use, all we know right now is that it's causing the lungs to almost crystallize a lot faster because the mechanism of delivery is so much heavier. The plumes of smoke that people are able to inhale with these mechanisms is bringing on those diseases a lot faster than any other traditional cigarette. The CDC, which is the Centers for Disease Control, estimates that 75% of current tobacco users want to quit and wish they had never started. The reason why people find it so hard to quit is because nicotine, A, is addictive, and B, it's everywhere. You can be an adult and walk into a grocery store and buy an addictive substance with no questions asked. Again, experts have said that nicotine is probably more addictive than heroin, cocaine, and alcohol. Again, for those two reasons, not only because it's addictive, but because it's available. And so when folks are trying to quit, it's still everywhere, and it's still somewhat socially acceptable. It's estimated that a user can try 7 to 10 times before they're successful, but most notable is that only 4% of tobacco users are actually successful in quitting cold turkey. So what we want to do is make sure, much like other addictions, that we're utilizing evidence-based approaches, clinical evidence-based approaches to help people quit. So the American Lung Association created this program back in the 80s. This is an evidence-based program that over time has modified to make sure that they're on the up and up, if you will. And what it utilizes is two approaches: pharmacotherapy, which is utilizing medication or nicotine replacement therapy to help with the physical dependence, and then a 7-week group facilitated program to help with the behavioral dependence. Over that 7 weeks, users come in with a trained facilitator, and they go through the program that has been designed by the American Lung Association. By week 4, we have a quit date, and then the next 3 weeks after that, we discuss how to avoid relapses. Any tobacco user over the age of 18 can benefit from this class. The one thing that they need to be sure of is that they're ready to quit. We want to make sure that people understand that they can quit. Most users are not coming into this class the first time trying to quit. Most users have tried several, 5, 10, 20, even 40 times to try and quit, and thus they have a sense of shame and failure because they weren't able to do it. What we want to encourage people to understand is that most likely they were not utilizing both the physical dependency approach and the behavioral dependency approach. And so when people come in, anybody can benefit from this program. The only people that we're not utilizing for this program are those under the age of 18. Smoking is, and tobacco use in general, is still one of the largest preventable interventions that we can use. The chronic disease that's associated with tobacco use reaches up to like 75%. So as a health system, if we really want to be able to give our patients preventable care and treatment, not only do we want to prevent tobacco use, but considering addicts are usually addicted before the age of 18, we want to make sure that to treat any other chronic illness or any other illness that will most likely come about for our patients, we want to make sure that we're targeting them. Montana in general, like we said, 17% are tobacco users. We want to get it down hopefully to 0.